Hi, Sandra Ford here with Trusted Senior Specialist, and today we're going to talk about everybody's favorite subject. You know what it is? Coronavirus 19. Now, we're not here to scare. We are here only to give the actual facts, and we're going to sprinkle in about a little bit of information of how Medicare is going to take care of the testing for you. Now, to begin with, coronavirus is a term used for viruses that affect the respiratory system. You've heard of this before, you don't remember maybe. In recent years, we've heard of two other coronaviruses, SARS, 2002 to 2004, and MERS in 2012. Now, there were only 2 cases of MERS in the US, and they were directly related to travel, which is much like what we're hearing with coronavirus or COVID-19. So today, we're going to speak specifically to COVID-19, the coronavirus of 2019. Now, it gets its name because it really wasn't discovered until the later part of 2019 in the province of China. Now, while we have had some recent cases reported here in the U.S., most infections have occurred in China, and as we hear recently, have been contained. One thing that has been confirmed is travel is the source of spreading, so those who have and are traveling will continue to be closely monitored by the CDC and the World Health Organization known as WHO. Here's what we want you to know about COVID-19. What are the signs I need testing? What to expect when the doctor does test you? Should I quarantine myself until the results are in? And is it best to go to the ER or my personal PCP if I suspect I do have it? So, before running out to get tested, ask yourself if you are likely at risk. You may need testing if you have symptoms of infection and, big and, you recently traveled to parts of the world where infection rates were high, or you may need testing if you had a close contact with someone who had traveled to one of those highly infected areas. So, what are the signs I need for testing? Now, with COVID-19, the symptoms will include fever, cough, and shortness of breath. So if you have symptoms but haven't traveled or have not been exposed to someone who had traveled, it's very likely you have another virus commonly known as the flu. So if that's the case, don't get excited. Take care of yourself like you normally would. Now, what to expect if you do need testing? If you do suspect you have it, you're going to call your provider. They're going to contact the CDC or your local health department, and they're going to give the instructions. Now, the CDC has verified labs throughout the U.S. who will conduct the test themselves. You may be requested, though, to wear a face mask to that lab, or if you go into your PCP's office to get that information. Now, testing will be performed in many ways. You could get a swab test of the nose or throat. They may use a nasal aspirator, a tracheal aspirate, a sputum test, and of course they can do a blood sample from a vein located in your arm. So there's several ways to do the test, and the results will vary depending on the type of test you take. Now, big question, should I quarantine myself until the results are in? Well, the best way to protect yourself and your family from COVID-19, and this goes with all illnesses, all viruses, is to follow the same basic practices that we've been taught from our mom and grandma. Wash your hands often with soap and water. Now, I know soap has been a rarity, but wash your hands with soap and water for at least 20 seconds. Sing a song. If soap and water aren't available, use an alcohol-based hand sanitizer, but here's the key, 60% alcohol. 60%, okay? Avoid close contact with people who are sick. Okay. Avoid touching your eyes, nose, and mouth. So when the grandkids come over, don't touch theirs, don't let them touch yours, just get those little cute tickles. And covering your cough or sneeze with a tissue, then throwing the tissue into the trash, and immediately wash your hands. And of course, cleaning and disinfecting frequently touched objects such as door handles on the refrigerator, stove, light switches, doorknobs, and please stay at home when you're sick. Now, is it best to go to the ER or my personal PCP if I suspect I have it? Now, if you have traveled to infected areas or had contact with someone who feels sick or had fever and difficulty breathing within 14 days, please call your doctor's office or your urgent care clinic, and they're going to tell you what the next step is to take. So be sure that if it's within 14 days, you going or be coming in contact with somebody within 14 days, then that's when you want to contact your doctor, and they're going to tell you the best practice. Now, real fast. I said I'm going to talk about Medicare. How does Medicare come into play here? Well, as of February 4th, if you have to be tested for COVID-19, I'm going to repeat that, as of February 4th, 2020, if you need to be tested for COVID-19 after February 4th, Medicare Part B will take care of that as part of their preventative test. So it is part of the preventative tests and screenings that Medicare does offer. Now, if for any reason there's a bill involved, that bill will be submitted to Medicare after April 1st. But you are covered from February 4th ongoing. So it is covered by Medicare. That's the great news. And again, guys, just use common sense. Again, the same stuff our parents and grandparents have been saying for the last 50 years. Wash your hands. Everybody have a great day. If you have questions, give us a call. We're here. Like, share, stay safe, and more importantly, stay clean.